So, vaginas. How do they work? This little gal is part of an elaborate network we call the female reproductive system. A little over half of our population have this system. This exclusive network aids in the creation of life. Without this system, you would not be here. Delving deeper, this structure is the reason that women PMS. The ovaries in the female reproductive system produce the hormones estrogen and progesterone that aid in the development of sex organs and the process of menstruation. Yeah, that blood comes from the uterus. It makes a woman bleed each month. Women PMS because of an increase in hormones, which result in menstruation. Why are they getting mad? Don't ask me. The system is just trying to clean itself out for pregnancy. The uterus is basically saying, you didn't give me a baby, so you aren't getting anything in return. The uterus's job is to hold a fetus for 9 months until it is ready to come out as a baby. The female reproductive system, the main job is to keep the fetus at homeostasis.
However, the system's health comes first. In order to keep the system healthy, you need to exercise daily, avoid drugs and alcohol, maintain a healthy diet, not overexert your body, both physically and mentally, having safe sex, and maintaining external cleanliness. Visits to the gynecologist will also ensure that your reproductive system is healthy. If a woman doesn't follow up, though, it could result in one of the many disorders that place the system out of homeostasis.
One of those disorders is a miscarriage. Imagine this. Your wife, mother, daughter, or friend is pregnant. And then one day, the happiness of the announcement disappears. She's miscarried. About 8 to 20% of women who are pregnant miscarry. Women who have diabetes, thyroid problems, or uterine abnormalities tend to miscarry more. Now women, don't think a miscarriage is your fault. Most miscarriages occur due to fatal genetic problems. However, they can also occur through infections, hormonal problems, or uterine abnormalities. Now, I'm not a doctor, but if you're having abnormal vaginal bleeding when you're pregnant, you're feeling nauseated, you're vomiting, and you have painful pelvic cramps, you should probably go and see a gynecologist. Unfortunately, once a miscarriage has occurred, it cannot be stopped. Fortunately, there are methods to help ease the miscarriage along, such as dilation and curettage. Curettage, you ask? They go in and scrape out your uterus. Ouch. Speaking of painful stuff, let me hand you over to my colleague, the ovaries.
Polycystic ovarian syndrome is where cysts chronically form on the walls of the ovary or ovaries. Unfortunately, doctors have not found a cause, but it is suspected that genetics passed through the generation may have something to do with them. Hormonal change in early teens often leads to PCOS after their first menstrual period. Depression, mood swings, hair loss on the scalp, hair growth on the face, acne, and oily skin are symptoms someone with this disorder may experience. Birth control, which is a form of hormone therapy, can help with the male-type hair growth on the face. Treatment consists of medicine used for hormone imbalances. There is no cure, however, controlling it lowers your risk of infertility, miscarriage, diabetes, heart disease, and uterine cancer. This syndrome is not very common, thankfully. Up to 10% of women are diagnosed every year with this disorder during a regular gynecologist visit.
Moving away from the ovaries, there are also disorders that affect the uterus. One of those disorders is called a uterine prolapse. Sounds pretty painful, right? Well, only 14% of approximately 27,000 women were found with it in a test done by the Women's Health Initiative. And most of them didn't even feel it. When their muscles loosen and their uterus slips into the vagina, the severe cases receive major symptoms. If the situation is severe, you could experience constipation, vaginal bleeding, sexual intercourse problems, and recurrent bladder infections. You could also notice the actual uterus descending out of the vagina, and as you can imagine, that's not a pretty sight. If this is the case, you should go straight to your gynecologist. They would usually recommend a uterosacral ligament suspension, a sacrospinose fixation, or a sacrocolpopexy, which are as complicated to say as they are done. In all though, these surgeries help to place the uterus back into its original position and hold it. There are non-surgical ways for less extreme cases, but they don't assure it will stay in place forever. Depending on your lifestyle, it could occur again. The most common risk factors are for women who are obese, who are old in age, and who have had over 2 pregnancies. However, you could reduce the risk with maintaining a healthy weight, estrogen therapy, and the practices mentioned earlier.
Another disorder of this body system is an ectopic pregnancy. This is where the sperm fertilizes the embryo in the fallopian tube and stays there. About 19.7 pregnancy cases out of 1,000 in North America have an ectopic pregnancy. How does a pregnant woman get this disease? Well, some of the causes are pelvic inflammatory disease, STDs, scarring from previous pelvic surgeries, history of ectopic pregnancy, the use of fertility drugs or infertility treatment. Now wait for the best part. Women who have this disease often experience symptoms of light vaginal bleeding, pelvic pain, nausea and vomiting with pain, sharp abdominal cramps, pain on one side of the body, dizziness or weakness, and pain in the shoulder, neck, or rectum. Yeah, that sounds great, right? Well, if you agree, then you're a horrible person. And for those of you who have had an ectopic pregnancy, I would say that I understand your pain, but then I'd be giving myself a cruel and unusual punishment. But anyways, luckily there are treatments available. Unfortunately, the pregnant woman will lose her child in the treatment process. The treatments, depending on how far the pregnancy has progressed, are either medication, which is Strexol, or surgery to remove the fallopian tube. If the pregnancy is detected early as ectopic, then medication is most likely the treatment the doctor will prescribe. Otherwise, surgery is the mother's only option to get the embryo that is killing her out. It's a sad topic, but luckily only 1.97% of North Americans will have an ectopic pregnancy. I guess that makes the situation better, but FYI, one tip to avoiding an ectopic pregnancy is to have safe sex. So encourage your friends and family members that safe sex is the best.
So, onto a very unpleasant topic, let's talk about obstetric fistula. The word obstetric means related to childbirth and the processes associated with it. And the word fistula is another word for an abnormal or surgically made passage between a hollow or tubular organ and the body surface. If we put these two words together, we are basically saying a hole between the rectum and vagina that is due from prolonged obstructed labor. Mouthful, am I right? It may sound bad, if not disgusting, but it gets worse. This hole connected between the rectum and the vagina can lead to symptoms such as urine leakage and feces leakage that will pass through the vagina. Due to this side effect, there is usually a very foul smell due to the passage of stool coming from the vagina. How do we treat this disorder? Well, there are two options. One, depending on the size of the hole, it will close up in time by itself and heal. Or two, it will need to be surgically repaired. This surgery is known as a fistulectomy, in which a fistulous tract is cut out completely. So what are the chances of getting this disorder? Well, it is estimated that about 5% of all pregnant women worldwide will experience obstructed labor. The majority of this percentage is mainly found in African countries such as West Pokot. The reason for this due to the region being poor in equipment and unhealthy living area. Without the proper equipment and people, it is difficult to try and repair the fistula.
Looking at all of these disorders, maintaining the health of the female reproductive system is vital. In maintaining the female body's homeostasis, the ovaries balance out the production of progesterone and estrogen to prevent the system from deteriorating. Now, not only in keeping the female's body in homeostasis, its job is also to keep the growing baby's body in homeostasis. It is very significant for the human race in general, as without the female reproductive system, our species would go extinct.
Are you guys done?